Dear viewers, this video is part 7 of the 7-part series on lymphocytes and immunity in the Medicine for Anyone in the YouTube channel. Failure of the tolerance mechanism causes autoimmune disease. Sometimes people lose immune tolerance of their own tissues. This phenomenon occurs to a greater extent the older a person becomes. It usually occurs after destruction of some of the body's own tissues, which releases considerable quantities of self-antigens that circulate in the body and presumably cause acquired immunity in the form of activated T cells or antibodies. Dear listeners, by the way, this educational video is made possible by Prescribon, the makers of e-prescription software for digital prescriptions available freely for doctors on the website www.prescribon.com. Doctors who are interested in this e-prescription can freely avail of its vast collection of more than 100,000 e-prescriptions. Now, coming back to the discussion, over 100 diseases that result from autoimmunity have been described and include 1. Rheumatic fever, in which the body becomes immunized against tissues in the joints and heart, especially the heart valves, after exposure to a specific type of streptococcal toxin that has an epitope in its molecular structure similar to the structure of some of the body's own self-antigens. Note: rheumatic fever is an inflammatory disease that can develop when streptococcal infection of throat is not properly treated. It is caused by an infection with Streptococcus bacteria. Rheumatic fever most often affects children ages 5 to 15. It is characterized by carditis, inflammation of the heart, arthritis, joint inflammation and pain, chorea, abnormal involuntary movements, and subcutaneous nodules. 2. One type of glomerulonephritis in which the person becomes immunized against the basement membranes of glomeruli. Note: glomerulonephritis is damage to the tiny filters inside the kidneys, that is the glomeruli. It's often caused by the immune system attacking healthy kidney tissue. 3. Myasthenia gravis, in which immunity develops against the acetylcholine receptor proteins of the neuromuscular junction, causing paralysis. Autoantibodies target the acetylcholine receptor at the neuromuscular junction, resulting in muscular weakness and fatigue due to the inefficient transmission of the acetylcholine signal. 4. Multiple sclerosis, MS, in which the immune system attacks the myelin that covers nerve fibers, disrupting nervous system communication. Note: multiple sclerosis resulting in nerve damage disrupts communication between the brain and the body. Multiple sclerosis causes many different symptoms, including vision loss, pain, fatigue, and impaired coordination. The symptoms, severity, and duration can vary from person to person. Some people may be symptom free for most of their lives, while others can have severe chronic symptoms that never go away. Physiotherapy and medication that suppress the immune system can help with symptoms and slow disease progression. 5. Systemic lupus erythematosus, in which the person becomes immunized against many different body tissues at the same time, a disease that causes extensive damage and even death when SLE is severe. SLE is an inflammatory disease caused when the immune system attacks its own tissues. Lupus can affect, that is the other name for SLE, it can affect joints, skin, kidneys, blood cells, brain, heart, and lungs. Symptoms vary but can include fatigue, joint pain, rash, and fever. These can periodically get worse, that is flare up, and then improve. 6. Graves' disease. Autoantibodies bind to and stimulate the thyroid stimulating hormone receptor, resulting in thyrotoxicosis. 7. Type 1 diabetes. A cytotoxic T cell response to the beta cells of the pancreatic islets, resulting in destruction of the insulin producing cells. Systemic autoimmune diseases, typically characterized by simultaneous damage in multiple tissues, example kidney, lung, skeletal muscle, nervous system, and skin. Unlike autoantibodies in tissue specific autoimmune diseases, which target tissue specific antigens, the autoantibodies in systemic autoimmune diseases are frequently directed against intracellular molecules expressed ubiquitously in multiple tissues. Example, small nuclear ribonucleoproteins targeted in systemic lupus erythematosus. Non-sustained autoimmune disease. Organ or tissue damage and dysfunction tend to be self-limited and resolve after the first attack and are very unlikely to recur. Example, epidemic Guillain-Barré syndrome. These diseases typically occur in the setting of infection and are associated with cross-reactive immune responses that recognize both components of the infecting organism as well as the target tissue. Note, Guillain-Barré syndrome, a condition in which the immune system attacks the nerves. The condition may be triggered by an acute bacterial or viral infection. Symptoms start as weakness and tingling in the feet and legs that spread to the upper body. Paralysis can occur. Immunization by injection of antigens. Immunization has been used for many years to produce acquired immunity against specific diseases. A person can be immunized by injecting dead organisms that are no longer capable of causing disease, but that still have some of their chemical antigens. This type of immunization is used to protect against typhoid fever, whooping cough, diphtheria, and many other types of bacterial diseases. Immunity can be achieved against toxins that have been treated with chemicals so that their toxic nature has been destroyed, even though their antigens for causing immunity are still intact. This procedure is used in immunizing against tetanus, botulism, and other similar toxic diseases. And finally, a person can be immunized by being infected with live organisms that have been attenuated. That is, these organisms have been grown in special culture media or have been passed through a series of animals until they have mutated enough that they will not cause disease but do still carry specific antigens required for immunization. This procedure is used to protect against smallpox, yellow fever, poliomyelitis, measles, and many other viral diseases. Passive immunity. Thus far, all the acquired immunity we have discussed has been active immunity. That is, the person's own body develops antibodies or activated T cells in response to invasion of the body by a foreign antigen. However, temporary immunity can be achieved in a person without injecting any antigen. This temporary immunity is achieved by infusing antibodies, activated T cells, or both, obtained from the blood of someone else or from some other animal that has been actively immunized against the antigen. Antibodies last in the body of the recipient for 2 to 3 weeks, and during that time, the person is protected against the invading disease. Activated T cells last for a few weeks if transfused from another person, but only for a few hours to a few days if transfused from an animal. Such transfusion of antibodies or T lymphocytes to confer immunity is called passive immunity. Allergy and hypersensitivity. An important undesirable side effect of immunity is the development under some conditions of an allergy or other type of immune hypersensitivity. There are several types of allergy and other hypersensitivities, some of which occur only in people who have a specific allergic tendency. Allergy and hypersensitivity. An important undesirable side effect of immunity is the development under some conditions of an allergy or other type of immune hypersensitivity. There are several types of allergy and other hypersensitivities, some of which occur only in people who have a specific allergic tendency. Allergy caused by activated T cells. Delayed reaction allergy. Delayed reaction allergy is caused by activated T cells and not by antibodies. In the case of poison ivy, the toxin of poison ivy in itself does not cause much harm to the tissue. However, on repeated exposure, it does cause the formation of activated helper and cytotoxic T cells. Then, after subsequent exposure to the poison ivy toxin, within a day or so, the activated T cells diffuse from the circulating blood in large numbers into the skin to respond to the poison ivy toxin. At the same time, these T cells elicit a cell mediated type of immune reaction. Remembering that this type of immunity can cause release of many toxic substances from the activated T cells, as well as extensive invasion of the tissues by macrophages, along with their subsequent effects, one can understand that the eventual result of some delayed reaction allergies can be serious tissue damage. The damage normally occurs in the tissue area where the instigating antigen is present, such as in the skin in the case of poison ivy, or in the lungs to cause lung edema, or asthmatic attacks in the case of some airborne allergens. Atopic allergies associated with excess IgE antibodies. Some people have an allergic tendency. Their allergies are called atopic allergies because they are caused by a non-ordinary response of the immune system. The allergic tendency is genetically passed from parent to child and is characterized by the presence of large quantities of IgE antibodies in the blood. These antibodies are called reagents or sensitizing antibodies to distinguish them from the more common IgG antibodies. When an allergen, defined as an antigen that reacts specifically with a specific type of IgE reagent antibody, enters the body, an allergen reagent reaction takes place and a subsequent allergic reaction occurs. A special characteristic of the IgE antibodies, that is the reagents, is a strong propensity to attach to mast cells and basophils. Indeed, a single mast cell or basophil can bind as many as 500,000 molecules of IgE antibodies. Then, when an antigen, that is an allergen, that has multiple binding sites binds with several IgE antibodies that are already attached to a mast cell or basophil, there is an immediate change in the membrane of the mast cell or basophil, perhaps resulting from a physical effect of the antibody molecules to control the cell membrane. At any rate, many of the mast cells and basophils rupture. Others release special agents immediately or shortly thereafter, including histamine, protease, slow reacting substance of anaphylaxis, that is a mixture of toxic leukotrienes, eosinophil chemotactic substance, neutrophil chemotactic substance, heparin, and platelet activating factors. These substances cause effects such as dilatation of the local blood vessels, attraction of eosinophils and neutrophils to the reactive site, increased permeability of the capillaries with loss of fluid into the tissues, and contraction of local smooth muscle cells. Therefore, several different tissue responses can occur depending on the type of tissue in which the allergen reaction occurs. Some of the different types of allergic reactions caused in this manner are described below. Anaphylaxis, widespread allergic reaction. When a specific allergen is injected directly into the circulation, the allergen can react with basophils of the blood and mast cells in the tissues located immediately outside the small blood vessels if the basophils and mast cells have been sensitized by the attachment of IgE reagents. Therefore, a widespread allergic reaction occurs throughout the vascular system and closely associated tissues. This reaction is called anaphylaxis. Histamine is released into the circulation and causes body-wide vasodilation as well as increased permeability of the capillaries with a resultant marked loss of plasma from the circulation. Occasionally, a person who experiences this reaction dies of circulatory shock within a few minutes unless treated with epinephrine, that is adrenaline, to counteract the effects of the histamine. Also released from the activated basophils and mast cells is a mixture of leukotrienes called slow reacting substance of anaphylaxis. These leukotrienes can cause spasm of the smooth muscles of the bronchioles, eliciting an asthma-like attack and sometimes causing death by suffocation. Urticaria. This is a localized anaphylactoid reaction. Urticaria results from antigen entering specific skin areas and causing localized anaphylactoid reactions. Histamine released locally causes 1. Vasodilation that induces an immediate red flare, and 2. Increased local permeability of the capillaries that leads to local circumscribed areas of swelling of the skin within another few minutes. The swellings are commonly called hives. Administration of antihistamine drugs to a person before exposure will prevent hives. Hay fever. In hay fever, the allergen-reagent reaction occurs in the nose. Histamine released in response to the reaction causes local intranasal vascular dilation with resultant increased capillary pressure and increased capillary permeability. Both these effects cause rapid fluid leakage into the nasal cavities and into associated deeper tissues of the nose, and the nasal linings become swollen and secretory. Here again, the use of antihistamine drugs can prevent this swelling reaction. However, other products of the allergen-reagent reaction can still cause irritation of the nose, eliciting the typical sneezing syndrome. Asthma. Asthma often occurs in the hypersensitive allergic person. In these individuals, the allergen-reagent reaction occurs in the bronchioles of the lungs. Here, an important product released from the mast cells is believed to be the slow-reacting substance of anaphylaxis, which is a mixture of 3 leukotrienes, which causes spasm of the bronchiolar smooth muscle. Consequently, the person has difficulty breathing until the reactive products of the allergic reaction have been removed. The administration of antihistamine medication has less effect on the course of asthma because histamine does not appear to be the major factor eliciting the asthmatic reaction. So, dear viewers, this is the end of part 7 of the 7-part series on lymphocytes and immunity in the Medicine for Anyone series in the YouTube channel. Thanks for watching.